Scleroderma by Sally Chi and Parisa Crane.
Scleroderma is an autoimmune disorder that affects the body's connective tissues. It is characterized by a hardening of the skin that can lead to swelling in muscle and joints, and it can involve various internal organs. It is also known as systemic sclerosis, and there's no known cure for scleroderma. There's two forms, localized and systemic.
Scleroderma has two forms, localized and systemic. Localized scleroderma has two subforms, morphea and linear. Systemic scleroderma has two subforms, limited and diffuse. We will go into further detail in the next couple slides.
Localized scleroderma involves skin hardening without affecting any internal organs. In addition to skin hardening, other symptoms can include reddish patches of skin that can thicken into oval shapes or single bands. The skin can also become discolored, as shown in these pictures. They will usually have a hypopigmented center and inflamed borders.
Systemic scleroderma has three stages. The first stage involves edema, second stage the skin becomes tight and shiny, and the third stage the skin becomes less tight and begins to die. Systemic scleroderma is different compared to localized scleroderma because it involves internal organs. As stated earlier, the two subforms are limited and diffuse.
The first subform is limited cutaneous scleroderma, which primarily involves hands, arms, and the face. There is less internal organ involvement compared to the diffuse subform. CREST is used to describe the symptoms of this form. Clients may have all or just some of the CREST symptoms. Starting from the top right, this picture depicts Raynaud's phenomenon. The bottom left picture is an example of calcinosis. In the bottom middle picture, this lady has the last symptom listed, known as spider veins, on her bottom lips. Right picture is an example of sclerodactyly, or thickening of the skin.
The second subform is diffuse cutaneous scleroderma, which has the worst outcome. It involves hands, arms, face, legs, as well as proximal extremities. This rapidly progressing form displays extensive organ involvement and skin fibrosis.
When I was playing basketball, I'm 6'6", so I was able to dunk, I was shooting, pass, and slowly but surely, I wasn't able to touch the rim no more. I wouldn't be able to shoot, couldn't pass it, couldn't run or jump, couldn't block shots, which is what I always did. And so I started taking yoga classes, Pilates, working out even harder. And then I started losing weight. I lost about 50 pounds. Finally, and this is the honest truth, the reason I went to the doctor, I was playing basketball, and some guy, he was like 6'1", 6'2", he dunked on me. And that never happened. Nobody shorter than me ever dunked. I was just like, something's wrong. And I went to my doctor, and she said, oh, we'll have to do some tests. And around February 2009, that's when she said you had scleroderma. At first, I didn't think nothing of it. I didn't even worry about it because I'm like, okay, well, I can work out or take medicine. But the other doctor, he said that you probably won't be working in law enforcement or playing basketball no more. And that's when I started taking it serious. I was thinking, okay, this is something that's just going to affect my future. So that's when I started panicking, kind of. The medications you take are pretty expensive, so I didn't take no medicines after a while because I couldn't afford it. I ended up in the hospital at the end of 2009 because I had ulcers in my stomach. The anemia came in, the Raynaud's, which is when your blood doesn't circulate and you get cold easily. So I kind of like messed my body up by not taking care of it. I'm real thin right now. I'm 6'6", 150. That's a big problem. People see a guy that's, ooh, he's real skinny. And then when I break it down to Scleroderma, I can deal with it. And they, a lot of women, they say, oh, you're good with deal with it. But I think at the other end, they're looking like, in 5 years, where is he going to be at? Because I can hardly get up out of a chair. And if I fall, I can't get up on my own. And I can honestly say, who wants to deal with that at our age? I can still drive. I can't dance no more. But, I can still bob my head to the music.
The etiology of scleroderma is unknown. In the United States, 7 out of 10,000 people are affected. Females and African Americans are at higher risk.
Symptoms vary from person to person, each person needing different treatments. Prognosis is based on the degree of internal organ involvement. Another thing for therapists to consider is the burden on family and caregivers. It is estimated that the total cost for systemic scleroderma is $18,453 per year.
Functional implications include dressing, feeding, personal hygiene and grooming, formal education, bathing, and shopping.
Based on research, a combination of paraffin followed by hand stretches and strengthening exercises were the most effective. These preparatory methods can increase range of motion, flexibility, and decrease stiffness.
Now we're going to share some occupational therapy strategies for 3 occupations. The first occupation is dressing. Due to the limited range of motion in the hands and difficulty manipulating small objects, we would recommend a couple adaptive devices, including a built-up button hook and adding loops to zippers. Splinting can also be used to prevent joint contractures. If lung fibrosis or fatigue is present, the therapist would want to educate the client on energy conservation techniques, such as sitting down while dressing, using bigger muscle groups, and gross motor techniques, and teaching them pursed lip breathing.
Stick, a very, very important device that you'll hardly ever see me without. I use it as my middle finger. I use it to type on the computer, do the remote control, answer the phone, push my hair behind my ears, brush my hair. I use it all the time. If I ever lost it, I would probably. A makeup sponge that I put on a straw. It's thicker than a straw, but it's a little stick because I can hold it between my thumb and my finger. And I just stick it in the makeup and I start painting. Every now and then, just for fun, I'll completely decorate one side of the really hard letting people I did that about once and figured out I had to come up with a better method.
The second occupation we will touch upon is feeding. Clients may have difficulty grasping the utensils. Some recommendations can be utensils with built-up grips or a universal cuff. A guarded plate may also be helpful if the client has difficulty getting their food on the spoon.
The last occupation we will talk about is formal education participation. Writing and typing can be a problem for clients with scleroderma. To help with writing, we can recommend writing utensils with built-up grip. To help with typing, a universal cuff with typing stick or a typing aid can be beneficial. With both of these, we would educate on proper positioning for joint contractures.
Okay, you're typing faster with that stick than I do with both my hands.
I was about to say, did we miss that class, Leslie? I did.
Back scratch typing 101.
It is common for clients with scleroderma to experience depression, anxiety, and embarrassment because of their physical appearance, which can lead to a decrease in quality of life. We would recommend the client to join a support group to meet and exchange information with others who have similar problems, and to also learn more about scleroderma. Having them do a leisure assessment can also help them stay involved and continue leisure participation despite their condition.